Hundreds of jobs are on the line tonight. Good evening, I'm Danita Harris.
And I'm Lee Jordan. MetroHealth system is planning to cut some 300 workers. News Channel 5's Pete Kenworthy is live in Metro. And Pete, right now the county-owned hospital is on track to lose more than $1 million this year.
Yeah, that's what we're hearing, Lee, and those financial struggles mean more layoffs at the facility that employs thousands of people in our area. But they are layoffs that many say were expected.
This is still a very tough economy. There have been a lot of layoffs and a lot of reductions, especially in the public sector. So I can't say I'm surprised. It's a challenge for Metro, but I'm confident they're going to come through it.
Cuyahoga County Executive Ed Fitzgerald says that patient care is not going to be compromised with a reduction in the workforce at MetroHealth Medical Center. In fact, this trimming of staff has been done before.
They actually had reduced these positions before and then brought some people back, and unfortunately the revenue projections weren't what they hoped they would be, or didn't pan out to be that way, so now they're kind of defaulting to back where they were a couple years ago.
MetroHealth provides millions of dollars of health care to people who are uninsured, and that's part of the problem. More people without jobs means more people who are uninsured and more financial stress for Metro. But as this Case professor of economics points out, there is a light at the end of the tunnel. As
health insurance reform kicks in and fewer people are uninsured, then hopefully this constant pressure that Metro is under and the constant need to go back to the county every couple of years and ask for additional funds in order to cover their expenses for the uninsured, hopefully, that will be something that they won't have to deal with in the future.
But for now, hundreds more layoffs for Cleveland and the old adage of doing more with less for those still at MetroHealth.
It makes it tougher on the folks that work there, and maybe the lines might be a little bit longer, but it still has a very important mission, and they're tough times, but I think they can still get the job done.
Now, MetroHealth released a statement late this afternoon saying that their uninsured patient visits had grown 8% over last year, while their county subsidy had dropped 10%. Therefore, part of their planning process for 2012 included a reduction in workforce. They didn't mention any number specifics there. Now, the statement also says the cuts will occur across the organization, and they are looking for ways to minimize those effects of the layoffs. Reporting live outside MetroHealth in Cleveland, Pete Kenworthy, News Channel 5.
Okay, Pete, thanks very much. And more hospital cuts when the Cleveland Clinic's Huron Hospital stops its outpatient services on Monday. The hospital ended its inpatient, emergency, and trauma services back in August. We're told the hospital's employees could be offered jobs at another location within the clinic system. The new Cleveland Clinic Community Health Center will open on Monday.